name. I think everyone knows Judge Sweet, but just to kind of give you a brief rundown in case you don't, Judge Sweet is currently serving in his second term as Rockwall County Judge. Prior to his 2014 election, he served 4 years as the mayor of Rockwall after being a member on the city council for 2 full terms. He was employed as a sales manager for 20 years with Coca-Cola, Pepsi, and Bimbo Bakery. And just a plug for Bimbo Bakery, most people don't realize we have the second largest bakery in the world right here in Rockwall. Judge Sweet has 2 sons who attend Rockwall High, and I think one just graduated, did he not?
One graduated, so I'll have one attending as a freshman next year. One graduated, Tuesday night, so yep.
Yep, fantastic. The Sweet family attends First Baptist Church of Rockwall. Judge Sweet is on the executive board of the North Central Texas Council of Governments. He also serves on the board of directors for the Rockwall Noon Rotary and the Rockwall Chamber of Commerce, as well as the chairman of the Rockwall Art Commission. If you've seen a couple of gorgeous guitars hanging around Rockwall, that was the art commission that took care of those, did a fantastic job. And if you listen to any of Rockwall sports on the radio, you might hear this same familiar voice, as he is a part of the broadcast team for all RISD sporting events. With that, I give you the Honorable Judge David Sweet.
Well, you read it just like I asked you to do. How about that?
Of course, that'll be $5.
Yeah, there you go. I'll pay that. Well, good morning and thank you. I appreciate the opportunity to come on and visit with you guys. And this is the second one I've done this morning. I was over with the Economic Development Corporation for the city of Rockwall. And we were talking about the impact that this virus has, or has had. And I'll get into kind of some numbers here, but with the Economic Development Corporation, we were looking not only from the reporting standpoint of the virus, but also the impact that it's had throughout our community on businesses, the impact that it's had on sales tax revenue. As they were reported yesterday, sales tax revenue for the month of April was reported yesterday. So we were just discussing all of that. And it's very simple in that, there's a few things that there's so much that's unknown about this virus. And can you hear me well? Does everybody hear me? All right, good. But the knowns are that if there isn't anyone that has not been impacted one way or another, directly, either directly by illness with this virus, or having a loved one or someone close that's been ill, or obviously with the impact on their lives, either loss of unemployment filings this week were up significantly. I saw that this morning on the news. Or businesses that have closed or anything of that nature. It's definitely been a trying and challenging time over the last few months. I've told folks that, as you read my bio there, Jerry, by the end of this term, I will have been blessed and honored to serve as an elected official for 16 years in Rockwall, 2 terms, as he said, with the council member, 2 terms as mayor, and then over here 2. So I ran into some pretty crazy stuff. Some self-inflicted, just part of making decisions, if you will, but dealt with some really, really challenging and tough things during my term, and nothing touches this. Nothing at all. This has just been one of the most trying and crazy times. But I am proud of our county as a whole. As an organization, I'm extremely proud of the way that we've been able to handle things, our individual cities, our school districts. We host early on, I created county judge is by statute is the emergency management director for a county. Mayor is for a city, obviously then the governor on the state level and the president is on the national level. Thank goodness that the Commissioner's Court had the foresight years ago to create an emergency management department. So I do have an emergency management coordinator, and we've got a deputy emergency management coordinator that work with me, that are professionals from that standpoint. And I can't tell you how great of a job and how proud I am of those two lady, emergency management coordinator for the county is a lady named Barbara Neville. And then her deputy is a guy named Jared Rawson, and those two have done an outstanding job. With those working in tandem with those two, we created I created a coronavirus task force, if you will, on the local level, and asked each one of the cities to send us representatives that would serve and help guide and evaluate things, and also being able to take a significant load, if you will, off of my desk and off of Barbara's desk as we went through this. And that group has been extremely proactive, and they've been extremely valuable. Each one of the city's city council member for each one to work with, each one of us to work with. And I'm like, okay, that's good. Thank you, man. And they worked hand in hand. We also I'd moved the elections coordinator. Well, let me tell you a real quick story. That first week that we went through this, I've gone back and counted this. I had about 1,500 points of contact, whether it was by email, phone call, or text within about a 5-day time frame. It was extremely overwhelming. That's why I felt the need to be able to get some folks to be able to assist us and point that, and chose a gentleman that's our elections coordinator to slide him over to lead these efforts for the county. He's a retired command sergeant major. Then in battle, he started over Iraq, and I thought, what a perfect opportunity here to have an individual that has served in the capacity of having his folks, his staff, the members that are working with him with their lives on the line. And that's, and was successful in leading those efforts. And he's done an outstanding job here for the county of leading those efforts. Kind of get into some testing, and obviously with you guys, you're very aware of the impact on understanding who's the most vulnerable to this virus. There is still a high level of unknown, but the one thing that is one of those things that is definitely unknown is the impact that it can have and how quickly it can happen with our seniors. There's no question about it. So thank you for what each and every one of you are doing, and I'll get into some of it's pretty cool to see Marie on here is bragging about how I've got the update on tests in each one of the facilities, and well, I'll touch on that just here in a second. But let me just speak to the test, to the numbers here in Rockwall County as they sit right now. There have been an estimated number of right at 3,500 tests that have been administered to Rockwall County residents. There have been 230 confirmed positive cases. We had 6 that were confirmed yesterday. They were all in the city of Rockwall. We have 172 estimated recoveries, and we do know that number is behind. It's probably closer to, I would just based on the trend as far as reporting is concerned, it's probably in the 180s, if not a little bit higher than that. But we get that number reported to us from the Department of Health and Human Services bi-weekly on Tuesdays and Thursdays. And unfortunately, that number is based on last Thursday. They're in a process of transition as they're getting ready to, that next phase is with some tracing and the ability that they're going to have to do with being able to report that. So it's a down week for reporting on recoveries. The reason that we know the positive tests, those are actual to-date givens. That's true, tried and tested factual, because in Rockwall County, we have a county health authority who's appointed by myself and the Commissioner's Court. That's Dr. Bonaquisti. And then the health department that supports this is the Department of Health and Human Services, Region 2, Region 3. So, and when a case is confirmed, they contact the health authority. This is the case. This is the situation that he makes contact with both of our 2 dispatch centers here in the county to protect our first responders, so they would know, address verified if they were to make a call that there was a confirmed case of COVID. And then he also contacts me, and then we immediately go into reporting of those numbers. So that's why that's an actual to-date number. Again, right at 3,500 tests that have been administered to Rockwall County residents, 230 confirmed positives, 172 recoveries, and of course, unfortunately, the 15 We have 15 fatalities here in Rockwall County, and they're all out of the Broadmoor facility. Let me touch on Broadmoor just for a minute. So those numbers total, there's been 42 residents that have tested positive for COVID. 23 are documented recoveries. They've had 26 staff members that have tested positive with 23 recoveries. The good, and of course, unfortunately, the 15 fatalities. Here's some good news. So they're in the 7th round of testing in that facility. Results came in, 0 new positive cases. Mm-hmm. 0. I don't know that I've, yeah, exactly. Thumbs up there from Jerry. I don't know that. I didn't know what to say when I finally got some good news out of there. But 0 additions, and they've been going down over the last few rounds. But unfortunately, as any of you that deal with seniors, the impact that it has, some of those folks that, then it was a really, really rough thing when when somebody is positive, and we've got all the good news going around it, that we've got a reduction in new cases, but this isn't going to end good for 1 or 2 or 3 folks, and that's played out that way. So again, 7th round of testing completed, 0 new cases. There are no residents from Broadmoor that are in the hospital as a result of COVID at this time. There's 4 that have yet to recover, that are still in the recovery, but they're stable and they're in the facility. So I think that at this point, they've at least on that road to recovery, or at least things are going in the right direction. With this virus and asymptomatic, and a couple of you that are on here, Marie, Elizabeth, some of the others, what this, you're always exposed. You're always exposed. All you got to have is an asymptomatic person get, in the wrong place at the wrong time, if you will, and what that impact can have on that organization. Go back to the first case that we had when I'll never forget the first phone call that I got from Broadmoor when they had the one case that was positive, and how quickly within a week that there were 6 confirmed positives. And that's when they implemented that facility-wide testing, and we saw some increases in residents. But the thing that made you pause and stop was when they tested their staff, and they came back with 20. The first round of testing had 20 positive cases in there. I think right at half in terms of those that were beginning to show signs and those that were asymptomatic. So unbelievable. Hats off to every single one of you that have been they're running the other facilities here within Rockwall County, all the other 13. As we know now, I've kind of touched on Broadmoor, Brookdale, and somebody from Brookdale on here. Wave at me.
It's Sherry. Excuse me, Ashley down at the bottom.
All right.
Yeah.
Last number that I had from as far as Brookdale was concerned was 1 staff member that had tested positive. Rowlett Health and Rehab across the lake in the county had 2 total. We've had 3 total that have been out of Royce City Medical Lodge. And then that's it. The Rockwall Nursing Center had 0. Rock Ridge has 0. Lakeshore Assisted Living 0. Revere Court out of Rockwall 0. Some testing opportunities there. We've got to visit some of those folks over there, but they have 0 cases. 0 out of Essential. Highland Meadows, wave at me. Yeah, where we at on Hot? Yeah, 0 cases.
That's Marie.
There we go. Marie and Highland Meadows at 0.
Raise your hand.
Liberty Heights at 0. So that kind of give you an idea of kind of where we are as far as the facilities are concerned. Trying to think of what I wanted to kind of touch on next. One of the things that we look at, so as the governor has taken over the control of the phasing of that opening up strategy, what I've encouraged, what I've asked our team to focus on, the emergency management team that is we focus daily on hospital. We have an NLAC report that comes from a report that comes from the COG, from the North Central Texas Council of Governments that shows us an actual snapshot of the conditions of our hospitals. And that's something that we're supposed, if you remember correctly, one of the first things that was mentioned, which made sense, was our concern about a tremendous impact and an increase in load on the hospitals. That was one of the big, major concerns. And the good news is that hasn't occurred, but that's a report. We get a report daily that here in Rockwall County, the Presby and Baylor Lake Point, both those two report this number, and we make sure that we watch the bed occupancy level. We were interested to see how many people have been admitted either into ICU or in the general population within the last 24 hours from COVID. We want to watch to make sure that it's a manageable availability on ventilators. And then we also look at the last 24 hours of suspected COVID folks that have visited the emergency rooms. And the good news is on all of those categories that we have been, that we're performing within the acceptable level. There's only one level of concern, and that is the number of suspected COVID positives that have visited emergency rooms. So they haven't been tested, they have not been placed into or not been admitted into the hospital, either general or into ICU, but that number's a little up. So we've got to continue to watch that. And we have a call, it was daily, that I host with county leadership, representatives from each and every one of the cities, all of our first responders, both the two school districts join on that call, and then Representative Holland and his staff, and State Senator Bob Hall and his staff members join us on that call. But we were doing it daily, then we went to Monday, Wednesday, and Friday. We have trimmed that back to Monday and Friday. We'll also have representatives from both the hospitals and our health authority on that. And we'll break these numbers down, and we'll discuss that and see what those trends are and how those are playing out, and see if there's anything that we need to be concerned about with that. Another thing that we look at is availability of personal protective equipment, PPE. Anybody, I know you guys would know this, the impact the concern right out of the gate. We didn't have enough. I mean, we knew that. And so we stay focused on making sure that as an organization, that we have enough for our first responders, as well as we have an ability to advocate or through requests of the Texas Department of Emergency Management, some of those resources for for hospitals to do a little bit better job, or obviously have access to that a little bit more, but for some of our senior facilities, for dentists and others here in the community. And I ask that our emergency management team continues to work to make sure that they have a good idea of availability of personal PPE for our county, for our cities, and then to ensure that if there's any other level of concerns that we act on that. And then availability of testing. That was another one that right out the gate, we kept hearing, oh, there's from Washington, basically from the national level, there's an availability of testing, and that wasn't playing out so well. It wasn't making its way down to the local level that well. And since that has broke, and the parameters in which someone qualifies for testing, the increased access to testing, we make sure we worked very hard to make sure that we had those public testing sites that have been here in the county over the last few weeks as an extension of the Texas National Guard. And Lake Point's been a very good partner in allowing us to utilize the parking garage over there to host those public testing sites. That's another thing that we will not back off of, is again advocating for access to testing for Rockwall County residents. And it was a very tough hill to climb there for a while, but that's played out very well, and our residents have responded to that. If you look at the total numbers of tests that have been administered at Lake Point, they're higher than I think all but one of the public testing locations in this region, Region 2 and Region 3. So it's not just Rockwall County residents, but this area has responded well, and of course that Lake Point facility is easy to access.
I believe there's free testing today.
That's correct. Yep, sure can. Good call out. I like to say we worked good together, Lori. Thank you. Yes, availability on testing today. This is a testing day over there. We continuously get some of those results. They're a little bit behind as right now, but I'll point something out to you. The first 2 weeks of testing that were done over there, there was right at 500 tests that were administered. There were only 5 positives that were reported. That's a good thing, obviously. The first week it was 3, and 2 of those were Rockwall County residents. 1 was Dallas County, and then the second week of testing in that place, we only had 2 positives that came back, and 1 was Rockwall County and 1 was Dallas County. So while this thing is absolutely real, and again with Broadmoor that just ate us up, we've been able to see what that impact it has been, what it's played out in a senior facility like that. We have been blessed and very fortunate here in the county that we haven't had some of the drastic, the horrible outcomes that have gone on with some of our neighbors. Other thing that I wanted to mention was another thing that I'm very proud of, and that is in our detention center, our jail. If you look over just a simple search on the internet, impact in detention center, it's just as impactful, wreaks havoc, and can get out of control and spread very quickly if it breaks out our detention center. We've had 0 confirmed cases, and there's been an extreme high level of proactive, this is on behalf of our leadership team over there, in being able to prevent so far, this a virus outbreak in there. If you sneak over and look at Dallas County's numbers, they've got more cases. They've had more confirmed cases in their detention center than we have countywide. So I'm very, very proud of that. And we knew early on the 2 things from a county judge's perspective looking out as the county as a whole, the biggest concern would be the seniors, the vulnerability and the impact that it would have in an organization. But from an operations standpoint, internally for a county was the detention center. So I'm very proud of those folks. Now I'm Jerry, I'm gonna stop there and see what kind of questions that anybody has for me, and I'll do the best job I can to address them.
Thank you. And thank you for the good news from Broadmoor.
Amen.
You know, I think many of us on this would tell you that we're watching and we're praying for them as a whole, because this has been very hard on them.
Yes, ma'am.
Yes. Anybody have any questions? Yes, Donnie.
Thanks, Lori. Hey, and thanks, Judge, for your time with us this morning. My question relates to the release of information and kind of what your perspective is on that. And I don't mean to sharpshoot at all. My last 10 years in the Army was in the emergency management world. And I know one of the hardest things to quantifiably measure is prevention, because you don't know what would have happened if you hadn't taken the action you did. But my question is, has there been any consideration when you identify the positive cases in kind of tracing back where that person has been to identify, if you have 10 new cases in a day, to identify 5 of them, were at my brick and mortar. And so maybe there's something going on at my business that needs addressed, and maybe people should stay away from there for a couple of days until I get that fixed. Has there been any discussion of that kind of analysis over?
Absolutely, and it's controversial, and that's not going to. The good news on that, I guess, if you will, would be that that's not going to be dropped in my lap or dropped into my emergency management or coronavirus team. Some of it's going to be dropped into someone else that's on this call, and she could probably speak to it here in a minute. That's Amy. Amy, are you hearing me there? As far as tracing is concerned, but there's a little bit that's going to touch with some of the folks in ag extension, if you will, that's been our very good partner into this. She kind of touched on why they were chosen, if you will. They had really big success in the last, the hurricane was one that they kind of played out in terms of their ability to communicate based on the relationships that they have throughout the county is why they were chosen to pick pick that out. But in addition to some of the work that some of those folks will do, the Department of Health and Human Services is also responsible for a tracing portion of this. And they do and have been making that type of contact, if you will. And they'll make contact to do the best job that they can in terms of trying to figure out where the exposure is and where they've been within a certain amount of time frame. And that's why, you know, so I don't get an address. What comes to me from the county health authority is actually restricted from being able to do that. He can't tell me that. He can't say, Fred Jones and yesterday that positive case is Fred Jones at 123 Apple Street. Now, what he calls me to tell me, and we had to work with the health department to make sure. We were on a call 2.5 hours. The first weekend after cases started popping in, we were on a conference call on a Saturday morning, about 2.5 hours to work with them to make sure that they knew exactly what the bare minimums as far as expectations are concerned of what I was going to get, and that I had an attorney with me that said, no, this is what he can have. And this is what we're going to push to get, and that is, again, county reporting on time. Also wanted by the city, and then we've got it in a category as far as ages are concerned. If you go back and look at our reporting, you can see the way that we do that. And of course, we know the travel, if it was as a result of, or whether it's from community spread, or whether somebody's gone over into another location. There are other ways to be able to find all that good kind of stuff out. And I know all about the creativity of that. Everybody on here, when you get your dispatch folks to maybe mention some reported cases, or what places are not being monitored, addresses are not being monitored anymore. But it's a long-winded answer to your question there, Donnie, that yes, there is a tracing portion of this, and they've done a much better job. And it's just like on the reporting cases on recoveries and all of that nature. Right out of the gate, no. I don't believe they were in good shape on a national level, and definitely not on the state and on this local level of being able to, everybody was kind of pretty much caught off guard and punched right in the mouth, and they had a hard time with documenting recoveries, timely and accurate data release, and then also the tracing thing was a little bit behind. But I think they've got, I really feel confident in the fact that they're on top of that now.
All right. Thank you, sir.
Thank you.
Anybody else?
I have one.
Yes.
So have all the senior communities been tested, and do you guys have plans to test all of the senior communities?
Yes, that's what I was looking at on here. This is the most recent one. I've got one that I've got to follow back up on. We issued, so let me tell you what occurred. So, and we don't test. We don't provide the testing. It doesn't come that we can request through the Texas Department of Emergency Management, and we have been very successful on this, on being able to get access to testing. And if there's any facilities out here that need some testing, yes, submit it through. And I know quite a few of you know Barbara, the emergency management coordinator that works for me. Work with her and let her submit, because we've gotten some relief. We've gotten some assistance to where they've come in and providing testing. But early on, myself, there's 13 facilities that are identified here in Rockwall County. I worked with Mayor Pruitt in Rockwall and Mayor Nickel in Roy City, and we sent out a letter to each and every one of the facilities that said, we're not issuing this in an order. We're not interested in issuing an executive order, but we will if it's necessary. But you need to test these folks. You need to test residents, and you need to test staff members. And if you remember correctly, then the president mentioned that, made its way back down to the governor, and the governor came out, and it was pretty complicated the way that played out. But he mandated to have testing done. They narrowed it down to 6 specific facilities. The ones here in our county were Broadmoor, Highland Meadows, the Rockwall Nursing Center here in Rockwall, Beacon Harbor, and Rowlett Health and Rehab over in Rowlett, and then the Medical Lodge out in Roy City were the ones that were identified in that first phase. And then again, most of these other facilities have have tested on their own, and then we're continuing to work with them. So, got one on here. I've got some questions for, but the expectation was that all residents and staff were to be tested.
Sure. Well, thank you for being with us today, bringing us all this information. I know some of it's, like you said, trying to guess, prevent. It's very challenging for all of us.
Well, I want to do it. Thank you for letting me visit with y'all today. For you that work on that front line and these seniors, thank you for everything that you're doing. I know this is extremely trying. It's extremely stressful, but thank you for what you do, and thank you for the way that you're doing it right now. This is the extra cautions that you're taking for the organizations that support the seniors that are on here as well. You know, think of when I've got a Marine there with Meals on Wheels. Thank y'all. Thank you. Thank you. Thank you. Thank you. And one of the things that myself and the mayor of Rockwall and the city manager Rick Crowley were talking about the other day, that it's the impact. It goes back to the thing that one of you were saying earlier about the interaction with the seniors right now, how important those that can, how important that really is, because they've just been, you know, they're so isolated. And that isolation thing at this point right now is the right thing to do. I hate it. I can't stand it. The fact that some of these folks haven't interacted with some of their family members in what, 2 months or 3 months, I guess 2 months, 3 months. And the fact that some visits on us with some folks the other day, you can expect that to be at a minimum of 2 more months, probably, is what I've heard from the state level. So, so again, thank you for what each and every one of you do, and you there that are advocating for and work for with those seniors. Your job is always important, and we all know that. But in this environment, it's on another level of importance. And thank you for doing what you do in the way that you do it. Thank you.
Thank you again. Well, we have a few more minutes. Wanted to take time